Let's discuss interviewing the constipation and diarrhea. Here we have an illustration of pathogenesis of constipation. From the top, there is food stagnation and phlegm accumulation, which results to obstruction affecting the large intestine. On the right side, we have the Qi or Yang deficiency or Qi stagnation, which has lack of force affecting the large intestine. On the right side, we have the yin or blood deficiency and heat, which cause lack moisture affecting the large intestine, which result or compromises the transportation function, which results to constipation. For the symptoms, we have a severe constipation, dry stools, abdominal pain, distension, dry mouth, red tongue, rapid pulse, which is a form of excess, which indicates excess heat in the stomach and intestine, with a pathogenesis of excess heat in the stomach and intestine, which induces fluid and cause dry stool. For the symptoms of constipation with small stools, such as might be left by a goat, stools are not dry, may alternate with diarrhea, symptoms induced or aggravated by emotional stress or lack of physical activity, which is also an excess condition, which indicates liver Qi stagnation or liver attacking the spleen. For the pathogenesis, liver and spleen Qi stagnation will cause intestinal Qi to stagnate. Large intestine loses its transportation function. For the symptoms with dry stool or soft stool with days between bowel movement, has desire to defecate but lacks energy to complete movement. Extremely tired after bowel movement may include rectal prolapse. This indicates a deficiency condition on the spleen and lung Qi deficiency. For the pathogenesis, spleen and lung Qi deficiency will cause the large intestine to lose force in its transportation. Symptoms more common among the elderly or postpartum women with round dry stools, normal frequency, however, difficult passing of stools, dizziness, pale complexion. It is a deficiency condition, the blood and yin deficiency with the pathogenesis of blood or yin deficiency, which fails to moisturize the intestinal tract. For the difficult defecation with stool may or may not be dry. There is abdominal pain relieved by warm, cold limbs, weak or cold knees, pale tongue, deep and slow pulse. It is indicated by spleen and kidney yang deficiency. The pathogenesis is the yang Qi deficiency causes weakness to the large intestine's transportation function. Next is the diarrhea or loose stools. For the definition, it is a frequent passing of watery or shapeless feces. For the etiology and pathomechanism of loose stool, the pathomechanism of diarrhea is usually too much fluid or dampness accumulating in the intestine with increased intestinal peristalsis. The main pathological change which cause diarrhea occur in the spleen and stomach where dampness originates as a pathogenic factor. Dampness can arise from either the exterior, such as an attack of damp heat or damp cold, improper diet, or some organ dysfunction. Interior dampness arises from a dysfunction of the spleen. It is either due to liver attacking or to deficiency of the spleen and or kidney. If the spleen functions or transportation fail, dampness will accumulate. So we have here the pathogenesis of diarrhea. From the left, if there is an improper diet or exopathogenic dampness, this is an external dampness. On the right, if there is liver Qi stagnation, spleen yang deficiency, kidney yang deficiency, This results to internal dampness, which there is accumulation in the large intestine and result to diarrhea. For the symptoms of acute onset foul-smelling stool with blood or mucus, burning sensation in the anus, tenesmus. There is a damp heat in the lower burner. For the diarrhea with watery stool, abdominal pain relieved by warm borborygmus, tenesmus, this indicates cold, damp invasion. For the diarrhea after overeating with smelly stools with undigested food and copious foul-smelling gas, this indicates food stagnation. If there's a diarrhea with tenesmus induced or aggravated by emotional stress, alternating with constipation, this indicates liver fire attacking the spleen. If there's dark green watery diarrhea with foul smell, severe abdominal pain that resists pressure, pain is not relieved following passage of diarrhea. This indicates a Yang Ming Fu pattern. All of this is an excess type diarrhea, an acute onset, short duration with frequent diarrhea. For the symptoms with chronic diarrhea or loose stools that contain undigested food, diarrhea worse after eating greasy or cold raw food. This indicates a spleen deficiency. If there is early morning diarrhea with undigested food, diarrhea immediately follows intestinal borborygmus and abdominal pain, which is relieved after passing diarrhea. This indicates a kidney deficiency. So this is a deficiency type. Chronic duration conditions appears intermittently. Thank you for your attention.